Causes of depression: unraveling the risk factors. Learn about the risk factors of depression and be attentive to warning signs. This comprehensive guide explores the biological, psychological, social, environmental, and lifestyle aspects that increase the risk of the illness. Depression is a common mental illness that affects millions of people around the world. Imagine waking up every day with an invisible weight on your chest, a profound sadness that drains the joy from life. Although depression may seem to come out of nowhere, there are various factors that increase the risk of its development. In this article, I'll help you unravel the causes of depression, exploring the biological, psychological, social, and environmental factors that contribute to this condition. By better understanding these risk factors, we can be more attentive to warning signs and seek professional help early. After all, depression is treatable, and the sooner it is identified and treated, the greater the chances of complete recovery. Biological factors: when brain chemistry becomes imbalanced. Our brain functions as a complex network of chemical connections. In this network, neurotransmitters such as serotonin, norepinephrine, and dopamine act as messengers, regulating mood, sleep, appetite, and the sensation of pleasure. Neurochemical imbalance. Some studies suggest that depression may be associated with an imbalance in these neurotransmitters. When there are low levels of serotonin, norepinephrine, or dopamine, brain function can be affected, contributing to the emergence of depressive symptoms. Genetics: a hereditary predisposition. Depression also has a genetic component. People with a family history of depression are at higher risk of developing the illness. However, having a depressed family member does not mean that you will inevitably suffer from the disorder. Genetics function as a predisposition, and the interaction with other risk factors throughout life contributes to its development. Psychological factors: negative thoughts and low self-esteem. Our way of thinking and interpreting the world also influences mental health. Patterns of negative thinking, such as rumination, dwelling on negative thoughts, and cognitive distortion, interpreting situations unrealistically, can contribute to the development of depression. Low self-esteem and feelings of worthlessness. Individuals with low self-esteem tend to self-criticize frequently and harbor a negative view of themselves. These feelings of worthlessness and inadequacy can fuel depression and hinder motivation for engaging in pleasurable activities. Traumatic events and significant losses. Traumatic life events, such as physical or sexual abuse, serious accidents, grief, and significant losses, can trigger depression. These experiences generate immense emotional distress that, if not properly processed, can evolve into a depressive episode. Social and environmental factors: the role of life context. The environment we live in and the social relationships we cultivate also play a significant role in mental health. Let's examine some social and environmental risk factors. Social isolation and lack of support. Humans are social beings. Chronic social isolation and lack of an affectionate support network can contribute to the onset of depression. Imagine a plant deprived of sunlight. Without solid social connections, individuals may feel lonely and helpless, becoming more vulnerable to depression. Chronic stress and excessive pressure. Chronic stress, whether in the workplace, relationships, or other areas of life, can deplete our emotional reserves and affect mental health. When stress becomes chronic, the body enters a constant state of alertness, which can lead to the development of depressive symptoms. Financial problems and material insecurity. Financial problems and material insecurity are also risk factors for depression. Constant worry about money and difficulty in meeting basic needs can generate anxiety, distress, and feelings of hopelessness, contributing to the depressive state. Lifestyle factors, habits that can influence mental health. In addition to biological, psychological, social, and environmental factors, our lifestyle also impacts mental health. Here are some habits that can increase the risk of depression. Sedentary lifestyle and lack of physical activity. Regular physical activity is essential for the production of neurotransmitters such as serotonin and endorphins, which regulate mood and well-being. The absence of physical exercise can contribute to the development of depression. Unbalanced diet and excessive sugar consumption. What you eat impacts brain function and mood. A diet rich in refined sugars, saturated fats, and processed foods can affect neurotransmitter production and increase the risk of depression. Conversely, a balanced diet rich in fruits, vegetables, whole grains contributes to mental well-being. Alcohol and drug abuse. Alcohol and drug abuse can be a risk factor for depression and can worsen existing symptoms. These substances interfere with brain function and can lead to mood changes, anxiety, and feelings of guilt, exacerbating the depressive condition. Insufficient sleep and poor sleep hygiene. Sleep is essential for the body's restoration and mood regulation. Poor sleep quality, characterized by frequent insomnia or excessive sleep, can disrupt neurotransmitter production and increase the risk of depression. Practicing good sleep hygiene habits, such as maintaining regular sleep and wake times, is essential for restorative sleep. Depression is a complex illness caused by an interaction of various factors. There is no single cause, and individual vulnerability plays an important role. By understanding the biological, psychological, social, environmental, and lifestyle factors that increase the risk of depression, we can be more attentive to warning signs and seek professional help early. Remember, depression is treatable. With the correct diagnosis, therapy, and in some cases medication, individuals have a great chance of overcoming depression and regaining quality of life. Do not suffer in silence. Seek help from a mental health professional and move towards emotional well-being. Frequently asked questions. Question 1. If I have a family history of depression, will I necessarily develop it? Not necessarily. Genetics serve as a predisposition, and interaction with other risk factors throughout life contributes to its development. Maintaining healthy habits and seeking emotional support can reduce the risk. Question 2. Can going through a tough time, such as losing a job, cause depression? Yes. Stressful events and significant losses can trigger depression. However, the duration and intensity of symptoms determine whether sadness constitutes a depressive episode. Question 3. Is it possible to prevent depression? While there is no foolproof way to prevent it, adopting healthy habits, fostering good social relationships, engaging in regular physical activity, and seeking professional help at the onset of symptoms are important measures to reduce the risk. Question 4. I am introverted and prefer to be alone. Does this increase the risk of depression? Being introverted is not synonymous with social isolation. What matters is the quality of the social relationships we cultivate. Even introverts need healthy emotional connections for mental well-being. Question 5. Is there any relationship between depression and the use of social media? Excessive use of social media may be associated with a higher risk of depression, especially when it leads to unrealistic social comparisons or feelings of inadequacy. It is important to cultivate a healthy relationship with technology and prioritize face-to-face social interactions. We have reached the end of the audio Causes of Depression, Unraveling the Risk Factors. Did you like this content? Share with someone who needs support right now.